Leukemia. So leukemia, cancer of white blood cells. Sometimes you will see a patient may have symptoms like bleeding or like say gum bleeding, but sometimes you will see patient might have gone for a well-man checkup. Well-man checkup, and then you may have got something. So usually what you will see in leukemia, maybe the task says patient WBC count is this much. WBC count this much is equal to leukemia. All right. Okay. So sometime patient might have some presenting complaint, but sometime patient may not have any presenting complaint as well. So bleeding, gum bleeding, for example, and then you ask cancer symptoms as well, also weight, appetite loss, tiredness. Obviously, any cancer patient will be prone for infections, easy bruising, all those things you can ask. Now, what are going to be your differentials? So bleeding, gum bleeding. So ask for blood disorders, blood thinners, any instrumentation, trauma. Obviously, we're going to cover that thing. Now, in terms of risk factors, so smoking, alcohol, radiation exposure, that is very, 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 very important. Yeah. Home condition, care at home. Why we need to cover these things? Why? Because leukemia, patient is going to be prone for infections. So, we have got a thing like we can give flu vaccinations to the patient if they're prone for infections. So it's given to the elderly patients, given to the patient who's got chronic illness, and obviously it's given to the carer of these patients as well. So that is why that thing can be very, very important as well, right? General physical examination, I'll check the vitals, I'll do abdominal examination as well. And what you may get is a splenomegaly. And that actually proves, yes, what it is leukemia. And you will check the bruising site as well, how bad it is, right? We can do bleeding clotting profile as well. And, try not to go with the, like, what is the diagnosis here? I mean, it will be difficult for you to mention which leukemia it is, isn't it? I mean, is it AML? Is it CML, ALL, CML, CLL? So what you can is leukemia. You need to do further investigation and the specialist will be able to manage that thing. From our side, we understood patient has got gum bleeding, patient is prone for infection. And when we did the blood count, we found blood count, WBC count is 100,000. What does it mean? It's leukemia. All right, break this news, do proper ice. Ice is important every station, but as I said, it becomes even more important when we are dealing with a cancer scenario. Refer this patient, urgent referral, 2 weeks referral to a specialist symptomatic treatment. So whatever the presenting complaint, treat the patient accordingly. And again, the treatment will be decided by the team. MDT team, chemotherapy, radiotherapy, surgery, bone marrow transplant, it depends. They will be able to decide, right? What will be the follow-up? I mean, just follow up within 2 weeks time. Obviously, specialist is going to see the patient and give the warning sign as well. If there is any bleeding, it's getting worse, or the bruising, if it is getting worse, make sure you come back straight away or go to the A&E straight away. Right? Patient might have a lot of question. Is it serious? Am I going to survive? How much time I have got? Am I going to die? I think you will be able to answer all these questions. Please do not start with yes or no. Yeah, just give a diplomatic answer there. I can see you are concerned. The thing is, it's one of the possibility that you may have this cancer. We need to investigate it further. We need to find out what kind of cancer it is. And then your overall health, you have to see. And then the specialist is going to decide the treatment. Right? So this is how you have to give this kind of treatment. All right.